Before we begin, take a moment to reflect. How do you envision yourself being involved in healthcare innovations? What role do you want to play in shaping the future of health? Welcome to this session on skills for driving healthcare innovation. In our previous discussions, we explored the dynamic landscape, drivers, and opportunities for healthcare innovation in Africa. Now, we'll focus on the essential skills and mindsets that enable you contribute effectively to this vital field. By the end of this video, you will be able to identify key skills and mindsets needed to contribute effectively to healthcare innovation in Africa. You will also describe tools and methods for developing and testing health technology solutions, specifically in low-resource settings. Finally, we invite you to reflect on your own readiness to engage in healthcare innovation and identify areas for personal growth. To fully drive healthcare innovation, especially in the African context, certain key skills are paramount. These include design thinking. It's about understanding user needs deeply and creating human-centered solutions. Systems thinking. Recognizing how different parts of the healthcare systems connect. Digital literacy. Confidently using digital tools and data. And stakeholder engagement. Building strong relationships across various groups. Let's look at a practical example of these skills in action. Imagine a team of young innovators in Kenya, passionate about improving maternal health. They are working on a mobile app designed to help rural clinics track maternal health visits and send vital SMS reminders to expectant mothers, aiming to reduce complications and improve outcomes. Applying their skills, the team's innovation addresses these challenges directly. The team spends weeks interviewing community health workers and mothers in rural areas. They learn that poor mobile connectivity and low literacy levels are major barriers. They design an app with offline functionality and voice-based alerts in local languages. They realize the app won't succeed unless it integrates with existing health systems. They map out how the app will connect community health workers, clinics, and district health offices with smooth data sharing and alignment with national health reporting systems. The team uses open source platforms and cloud-based databases to build and test the app. They also train community health workers to use smartphones effectively for data entry and patient tracking. They collaborate with the Ministry of Health, local NGOs, and telecom providers to gain support, secure funding, and ensure sustainable implementation. Beyond specific skills, certain mindsets are crucial for navigating the complex world of healthcare innovation. Cultivating these ways of thinking is just as important as developing technical abilities. First, empathy. This means deeply understanding user needs, challenges, and aspirations by stepping into their shoes, especially those of patients, caregivers, and frontline health workers. For instance, a developer designing a health app spends weeks living in a rural village to understand the daily realities and technological access of its community members. Next, collaboration. This involves working effectively with diverse teams and engaging communities to create inclusive, sustainable solutions. For example, developers partner directly with local NGOs and community health workers to jointly design and test a mobile diagnostic tool, ensuring it is perfectly tailored for the specific challenges of the rural clinics. Finally, Adaptability. This is the ability to respond to challenges and unexpected changes with flexibility and to adjust innovations based on continuous feedback and evolving contexts. A good example is a startup that initially develops a smartphone-only app but shifts to an SMS-based system after realizing most users lack smartphones, demonstrating their flexibility and responsiveness to user needs. Take a moment for personal reflection. Of these crucial mindsets, empathy, collaboration, and adaptability, which one have you already cultivated in your personal or professional life? And perhaps more importantly, which do you want to intentionally develop further, and why do you believe that specific mindset will be key for your future contributions to healthcare innovation? To translate these skills and mindsets into tangible impact, innovators utilize specific tools and methods. These tools include prototyping and piloting. This involves rapidly creating early versions of health tech solutions and testing them in real-world, low-resource settings to identify challenges and gather insights early on. An example would be a team piloting a portable solar-powered vaccine cooler in rural clinics to assess its usability and reliability in extreme conditions before mass production. 2. Using data. This tool involves collecting and rigorously analyzing data to continually refine and improve innovations over time. A practical example is app developers who adjust a symptom tracker's interface or functionality after usage data reveals that patients struggle with the original navigation or input method, leading to a more intuitive and effective tool. 3. User feedback. This is about actively engaging end users, health workers, and communities to gather their insights and adjust inventions to better meet their needs. For example, community health workers might suggest simplifying forms in a mobile reporting app after finding the original interface too complex, leading to valuable improvements. Let's discuss how to navigate the challenges that exist in health innovation. This upcoming session will equip you with strategies to overcome obstacles and continue driving meaningful change in the health sector.